All right, we're back. Robert,
Hello.
thank you for joining us
Nice to be here.
from UI Health.
Yes.
We've gotten to know each other a little bit, and you're in another life a user of VisiQuate. Thank you.
Correct. Yes.
So we started this series as I was chatting with you about RCM Innovators, and it's really just we want to have a lot of conversations with a lot of people. What are you doing around AI, machine learning, other bots, back office automation? So let's just start with that. Like, what are you excited about in the revenue cycle, and or what are you focused on? Like, what gets you out of bed excited these days?
Well, I mean, right now we've just went through our Epic implementation, so we're kind of doing is a lot of post go live optimization, right? So we're still there's a lot of after you go live with a system like Epic, working through standard workflows and making sure that we're getting the accounts worked properly.
Yep.
And then I think as you get to those additional levels of data compared to my previous life, where we've got a lot more data that we can use, and then because of that, there's a lot more optimization that's possible, right? And so that's where once we kind of get the communication right, with the other pieces of the organization, then we can start thinking of automation. Now, as we get those communication pieces down too, there's also opportunities to automate there too. Because my team, as the director of revenue cycle, more of in the patient accounting world, has to rely on coding for something. It doesn't mean that coding really needs to touch a lot of these types of things, right? I mean, we can send that over there, and then they could say, you know what, every time that you send this is what we do, right? And so that's kind of where the automation, will come at some point.
You're looking for like opportunities where you can reduce touches, like any point that you can reduce touch. So they can work high, more accounts, more complex work, right?
Absolutely, yeah. Because we do have a lot of when you're dealing with high dollar inpatient accounts, you probably need people to touch those and to have critical thinking going on as to what's going on with this account. But a lot of and that's where we actually lose a lot of money too, is on those outpatient accounts that aren't high dollar. I mean, especially on the physician side too. On the physician side, if you're not working on automation, you're going to fall behind, very quickly.
It adds up. All of those $70 lab bills and
absolutely
$220 therapy visits, and
I mean, and right now, I mean, like a thing like VisiQuate, and this is what I do still. I mean, there's a certain amount of what's being left out there, right? And so you're just trying to find the patterns, and tools that can help you find the patterns are kind of the bread and butter in the revenue cycle.
Yeah. So doing some like pattern analysis, anomaly detection.
Yeah. You got we've got reason codes that are leaving balances, underpayment balances that are typical for various CPT codes, and we have vendor partners that we work with as well. But what we try to do is get the knowledge from our vendor partners, or internally, to eventually fix those on the front end, right? So that way we're not paying the 7% or whatever our rates are.
Yeah, absolutely. Yeah, the more leakage areas addressed in the front end of the revenue cycle, absolutely.
Yep.
So your purview is more in the back, insurance follow-up, and are you finding in a kind of post-COVID world, are you back to work in a central office? Are you virtualized?
We're a hybrid model.
Hybrid, okay.
And then I just recently started with UI Health, and that the prior organization was pretty much still 100% remote.
Okay.
But we're a hybrid model. We still have some spaces. About once a week, people come in.
Yeah.
Or as some people are on
just to have some
schedules.
Camaraderie and hang out and
to make sure that people are getting a touch point, maybe some education pieces.
Sure.
We still have an issue that I'm dealing with is some some paper and printing and things like that.
Oh, sure.
But so we're trying to work through that to get to eliminate that.
Yeah.
So that way, and once we are able to do that, then I think we'll be even a little bit more remote.
Yeah.
But at this point, we still have that one day a week, and we'll still reserve some spaces for people, just so that way we can have like the learnings and knowledge sharing.
How do you think about? I've been talking with a lot of folks about the notion around labor shortages. It's hard. Many of you are articulating that it's hard to find, billers and collectors.
It is very hard to find.
And so does automation, I think 3 years ago, automation was, we should do that. It makes sense. Work to the top of your credential, if you will.
Right.
But now it's becoming more and more of a necessity because you can't fill those gaps. So
Correct. Yeah, it is. I mean, the more we can work from our inventory in an automated fashion, that's what we need to be doing, right?
Yeah.
And if to a certain degree, it's it's a little bit of an arms race against the insurance companies, because they're doing the same thing on their end.
Sure.
A lot of the things that they're sending back to us never probably touched an actual person, right?
Yes.
So they're just sending it through an algorithm, pushing it back. So if we don't have
the bots are fighting.
Yeah,
the bots are at war between the provider
well,
and the
before
payer.
it was people doing those
Yeah.
things, and now the bots are kind of going to.
I worry about the money still being stalled so much, though.
Yeah,
'Cause it's
absolutely.
expensive to run a hospital.
It is. It is, and and you need to have, to a certain degree, payer. I think what's interesting is that there was a period of time in my career where the payer meetings were kind of going away because they weren't really fruitful.
Yeah.
You'd go in and you'd say, yeah, we're having these issues. I've seen those actually coming back, because now I think that to a certain degree, with that arms race, it's like, hey, you're sending us 80% of these denials. We're getting 80% of them overturned. Let's stop the madness.
Let's stop the madness, because
Yeah.
the cost to collect, I always say the cost to collect and the cost for a payer to adjudicate every touch.
Right.
As we all know, when people talk about a touch is $5 or $7, it's like, it depends on the touch.
Right.
Some touches are $2, some touches are $5, and some touches are $30.
Right.
If you're on the phone for
Well,
15 minutes,
if you've got to send that back to the nurse, right?
Yeah.
In the hospital, and she's got to look to
multiple compound touches
Right.
to resolve an account. Yeah.
Exactly. Now we're missing, like these types of where is the documentation, right? That is a very expensive touch that
Yeah.
you're sending it back to.
Yeah. Yeah, like administrative waste, the HFMA report a couple of years ago, 260-something billion in administrative waste just for the revenue cycle, right? Add inflation is probably already 325.
Right.
That's a lot of dollars not being directed to patient care. Are you finding that you can get your organization to invest? Because clinical innovation always gets the headlines. We all know that that's the right, always invest in the
Right.
patient. But our passion is helping our clients tackle that, 300 billion in waste, so that it is shifted, more to the patient value.
Yeah. I mean,
Whether it's patient engagement, patient experience, or the clinical setting and cost and quality of care.
I'd say, and prior to my life at UI Health, I did a lot of consulting and management consulting for companies, and in the last 5 years, I would say the openness of the clinical side to kind of learn more about the finance and the billing, and making sure that like before it was, we're going to create any workaround that we can possibly do,
Silos.
to not impact clinical workflows. And now you're seeing a lot more of the nursing and it's still not perfect, but I still think that organizations are open to working with the revenue cycle and understanding that it impacts bottom lines, right? And then in order to close some of those gaps.
Yeah.
And so I think the investment, the problem with investment, it is going up, but you've got a revenue cycle is a cost center, right?
Yeah.
So I think that people are being more strategic about it, right? So it's not as though like
I would
people are writing
argue that it's that's part of the challenge is that it's perceived as a cost center, it's really a gold mine of opportunity to automate and get, how do you improve yield
Exactly.
and optimize cost simultaneously?
Yeah.
Where, I was at a talk the other day, and one bot pays for 3 bots. We're already talking that same language, right? That incremental, go narrow, find value, and then use that to fund the next initiative.
Yeah.
Yeah.
Yeah, and I think that's starting to become a realization. It's like, okay,
Yeah.
I think within
You
my
can't keep kicking the can down the road, right?
Yeah, and I think honestly, within my organization, it's very clear. I think within the revenue cycle in particular, like you can create financial models that say, like, if we do this, this is the cost savings and potential like revenue uplift, right? So you can do a lot of those justifications rather easily, whereas sometimes like in other places it's not as clear cut.
Yeah, sure. Yeah, you want to do it in a way where it's like obvious. Right?
Yeah.
It's not.
Exactly.
It's not just a fancy.
We'll reduce denial. Like this, we've got $2 million in denials for this issue. If we can create this, we should reduce that by 70%. That leaves us with
I mean, it's big numbers. I think sometimes this stuff is murky. We've been involved in collaborations with clients where, focusing on some function in pre-service, really investing in pre-service with quality, led to like not hiring 100 FTEs, right? So it's like, if you focus, especially institutions that have some scale, the numbers are compelling. It's not these little incremental. These are order of magnitude changes. And again, can you find the 100? That's in many cases.
I don't know if this is something that you guys are currently doing, but I've always thought of it as, especially in the pre-service area. Right now, it's not at least widely adopted. I have never really seen it, personally. Is, hey, you've got a patient that is registering for this with this insurance, and 80% of the time you're going to get a denial for something, right? So something in the data set should, tell that registrar or the scheduler that something's wrong, right? Yeah. And that technology exists because Amazon and Netflix and everybody uses it to say, hey, you picked this, other people
I mean, you're mentioning
this.
a use case that we're always excited about, denial opportunity prevention.
Right.
And it's exactly how you said it, right? There's regression data and predictions that you can in real time say, on this insurance plan code, there's a couple more boxes to check, or if you don't think you need auth, even if the contract says you don't need auth, you do.
Yeah.
Go get auth. Proactive.
Right.
Yeah. I mean, those are the favorite ones, is when you can get upstream.
Right.
Did you guys have any lessons learned from COVID? Any sort of silver linings?
Well, I think in the revenue cycle, it has really helped us because our people, always were kind of, in the offices and large amounts of people. Yeah. And now those folks are generally going to be able to work more from home. Yeah. And I think that from a job satisfaction perspective, from what I've heard from all of, from the 2 organizations that I've worked with most recently, it's turnover for us is becoming less of a thing, because people,
there's more flexibility in their day.
Well,
it's about results, not time and attendance.
Yeah. So it's on management and leadership to understand, quality and productivity. Yeah. But that's on us. Yeah. To figure out what's going on with the team and make sure we're on top of that. But for them, it's essentially like an immediate raise. You're not paying. I mean, like, you probably have less childcare costs. You have less travel costs. Yeah. Commute
maintenance.
Time. Down.
Even just commute time.
Commuting time.
People
all
that
the things.
I hear stories. People that live 10 miles away in a city like Chicago. Yep. 10 miles. That could be an hour.
Absolutely. Yeah.
That's gain time. Yeah.
Yeah. I mean, so all of those things, really help us. I think, prepare for a more stable workforce, right?
Yeah.
And I think that it should be able to, because I tell people who are, kind of in between jobs, so it's like, you should think about this, because if you really want to do, remote work, revenue cycle work is
absolutely
perfect for it.
Sure.
You can go generally work anywhere in the country.
Yeah, absolutely.
You want to live in rural Indiana and have a huge
cross state
lines. Like you can go do that. I mean, maybe not for UI Health, unfortunately, but other places.
Sure. But you are seeing some of that. I've talked to some folks that are, used to, everybody drove in, and now it's like we draw from all 4 states. Right?
And I'm from rural America. I grew up in rural Wisconsin, and you're seeing it, even where I'm from, where now, people are moving back into, little tiny towns, and real estate's going up, and
the suburbs have power again.
Yeah, exactly. I mean the experts, right? You're not even near a city, you know? So it's really good for those communities.
Do you think about, or how do you think about gamification as it relates to workforce performance, working from home? Are you guys looking at, there's some great studies and great use cases around,
I'm a little bit new in my position. I'm certainly planning on doing a little bit more as far as culture building within my team. Gamification, and when it's really done well, can be a really fun thing.
Absolutely.
And so, I'm definitely something that I be open to and have kind of looked into the past. I think I remember a really good use case of I think it was Providence. I think down in California had a good gamification program where people were, earning badges and having their productivity was kind of leading to some additional benefits, right?
I mean, I think a lot of people. I like when my watch gives me an attaboy for getting some steps in. It's kind of nice, Why not? Because the shift that we're trying to help clients with around this is less about time and attendance. Yeah, everybody's got to kind of sign up for the day that they signed up for, but the flexibility. If you've got a single mom with kids,
you need 2 hours off in the middle of the day?
And soccer practice.
Yeah.
But you can do pay or work at night now.
Absolutely.
We've proven that a lot. So why not?
Yeah.
It's pay for results more.
I agree with that entire concept.
And that blend of, we all know non-forms of currency can be effective.
If somebody who else otherwise would have gotten out of the workforce, right? And now you can say, hey, we can be flexible around your schedule.
Yeah.
Once again, it comes on to the leadership to actually be able to follow up on that and make sure that, we've got things in place to monitor.
Yeah.
But if we do and we're comfortable with them, we should offer those as a differentiator for other industries that aren't offering those things.
Yeah, I love to walk the halls of our clients and talk to all, even down, and everybody loves friendly competition. So I find that like point systems and badging and stuff, some people think, oh, it's kind of cute. It's like, yeah, but this is bragging rights. This is like virtual hallway conversations where like, hey, I'm 200 points more than you. I made more calls than you, right? It creates a little esprit de corps even if you're at home.
Yeah.
Right.
Yeah, and I think it's, to your point, especially with the virtual workforce, it's a way to kind of, get people to connect a little bit.
Yeah.
For us, the challenges are that, like to a certain degree, we've got people that are kind of more specialized in their things, but that doesn't change the fact that there should be a way to gamify everything, kind of level the playing field.
Yeah, no, absolutely. What question should I ask you that I haven't asked you? We'll give you kind of an open
question. I don't know. Now you stumped me, I guess.
Well, we can come back to that one. I'll tell you what, I'll ask you, if you go out to the year 2025, we've been asking folks, some questions just to, what would you be excited about? What did you get done? Think out a couple of years. What would you be proud of?
I think, so in the next 3 years, I'm pretty sure, our plan is to definitely get a lot of more of those automation pieces in.
Yeah.
And I would also say like kind of early warning detection.
Yeah.
Right.
So you're using our alert system. I love that.
Right. So I think that with even still, everyone's getting better at denials. But if you can start flagging things within 1, 2, 3 weeks that this is happening, so often we find these things 3 months later. 4 months later, and then because we're looking at other things, we see there's an issue. Now we got to go back. If we can get more automation and more early detection types of analytics going on, then we can, like I said, get ahead of all the issues.
It's those prediction markers. It's all in the data. You've got to do a lot to curate that data. It's knowing payer behavior historically, but like also the last 90 days is different than the last 6 months. Right. How do you think about change management? A lot of the things that we're dealing with when you implement a new system, you're going live, that the idea of the bots can be intimidating. It's an education and communication very often,
well, that's a question you should ask me. So
there you go. That could be the one.
So my another life, I was a management consultant around change management. Right?
Okay, great.
So
I'm a big fan of change management. When it's done well, project management and change management done well, night and day difference.
True, and
those that underinvest in it, it's always more expensive.
Well,
you pay one way or the other, right?
You do. And the change management aspect of it is always kind of, people don't want to pay for it, because I always kind of view it as, if everybody did their job really, really well, you wouldn't need necessarily change management. Because people would know to communicate, get trainings, and just kind of and everybody would work together. But that's not the case, because it's not so much that people aren't trying to do their job well, it's just lost, right? And so the change management aspect is always, I've been saying that in my organization that I've been coming into a lot, is that we are not going to do anything where we don't communicate with another group and tell them our intentions. So, right now, and I think that, like, for, resolving denials, it's like, hey, these types of things need to go to another group to look at. Well, some places will just say, all right, well, we'll just create an Epic work queue and just send it over there. But we can't just do that. We have to call them up and say, here are the accounts, like, let's walk through this together. And that's a little bit on the front end. But then, are you familiar with work queues? Do you need a training on work queues? How do you resolve? What are the clicks that you're going to need to do? How much time are you going to need to spend doing this, right? You need to have those conversations a lot of the time up front, because if we just kick those things down the road, then all of a sudden they don't actually get resolved, and we're going to have a lot of anxiety and confrontation on the back end. And so, it's a thing like VisiQuate, right? The change management for that is, within the organization, these are the new metrics that we're going to have, right? These are the tools we're going to use for denial management. Here are the people that need to know how to do it. Here's the training on how to do all of those things, right? And so, I mean, it's critical in every phase of any sort of deployment, right? And so,
absolutely. It's like, I find it's a communication thing. It's showing them how it's actually good for them. Many times the initial is, this is change. People don't like change. But if there's something in it for them, if there's more flexibility in your schedule, if you have opportunities for training, I mean, I love the idea of every time you automate, you should be upskilling. People should feel like they are growing in their career. You teach them, hey, why don't you learn how to run an anomaly detection analysis or a process intelligence, right? It's things that, they're building some good marketable skills, and if you're treating people well, then they're going to stay. And
I agree. I mean, that's the skill set. I mean, you're going to end up with a portion of the revenue cycle staff that are going to feel a lot more like IT staff. You know, like
knowledge workers over time.
Yeah, exactly. Because it's going to be more so about, how are these data points coming in? and then helping with like process improvement initiatives, right?
And technology can help people become more knowledge workers, right?
Right.
With training and well, that's great. Well, hey, any other? Let me ask you this: what one piece of advice would you give your peers in the next 3 years around innovation?
In the next 3 years, yeah, I mean, I'll go back to the change management. I mean, if when you are implementing, I always kind of looked at it as like how big is this program?
Yeah.
And if you're implementing a major system, or there's bringing on an entire different type of process, it's probably worthwhile to not only have your project manager, but then also a change manager. And the reason being is because that change manager is going to kind of lay out the whole process for you. Say, here's the communications we're going to have. Here are the trainings we're going to do, right? And here are the milestones, and here are the various. And I think that the most important piece of that is honestly the upfront stakeholder analysis, right?
Yep.
Because that's where people kind of screw up, is that they don't think critically. They think, here's the groups.
Yep.
But if you go through a review of all the various stakeholders and everybody thinks about it, and just takes a beat and thinks about it for a few hours, you're going to identify other stakeholder groups and think about communications and training that are going to be needed.
Yep.
But if it's just left to the project managers and the people who are working it, that's where those periphery groups kind of get left out, and they could turn out to be critical. So, understanding what you're trying to implement and making sure that you're giving the change management a little bit of airtime.
Yeah. No, it's great advice when you're trying to take innovation and make it real and integrate it operationally. You can't underinvest.
No.
Yeah. Well, hey, I just want to thank you, for agreeing to do this, and it's been a pleasure to get to know you, and we want to have you back.
Absolutely. Well, thank you so much.
Yeah. Thanks, Robert.
Appreciate it.
Yeah. Have a good rest of your show at Becker's.
I will.
All right. Great.